you are at risk of severe heart failure due to senescent decline in your heart's electrical pathways. As the sinoatrial node deteriorates, arrhythmias, such as atrial fibrillation, become inevitable. Blood flow becomes inefficient, clotting forms, and strokes follow. You are facing irreversible damage, the kind that strips away your independence and forces reliance on others. As you age, the rhythm of your heart may change in ways that you're not even aware of. Subtle shifts occur in the electrical impulses that drive your heartbeat, changes that, for most, go unnoticed. This is not an isolated occurrence. It is an inevitability. Yet the lack of pain or any obvious symptoms does not mean the threat is absent. In fact, it may be growing silently within you, undermining your health in ways that are hard to detect and even harder to correct. At the core of this issue lies the biological process of aging itself. Over time, the electrical pathways in your heart, the very system responsible for maintaining its rhythm, begin to lose efficiency. The cells that regulate heartbeats may experience gradual wear and tear. This includes a decrease in the function of the sinoatrial node, the heart's natural pacemaker, and an alteration in the way the heart responds to signals. What was once a seamless flow of impulses can become erratic, but without a clear warning. Your heart may beat slightly faster or slower than usual, or irregularly, yet these changes are often subtle enough that you do not recognize them as alarming. This slow degradation can lead to conditions such as arrhythmias, irregular heartbeats that can range from minor to life-threatening. Atrial fibrillation, for example, may present itself as a brief sensation of palpitations or an unusual fluttering in the chest, but it may remain undetected, hidden behind what is often mistaken for normal aging. The heart may struggle to maintain its pace, and as it does, blood flow becomes less efficient. This inefficiency can lead to blood pooling in the heart chambers, increasing the risk of clot formation and strokes. The problem is not only biological but deeply personal. You are at risk of losing control over your autonomy without even knowing it. The absence of pain or clear symptoms can cause individuals to dismiss these changes as a normal part of aging. They might believe that slight dizziness after standing up or shortness of breath while climbing a few stairs is just something to accept. However, this is a warning. The body's internal systems are starting to falter, and the consequences may be irreversible. This failure to recognize the warning signs can lead to more serious consequences: reduced mobility, dependency on caregivers, and eventually a loss of independence. The risk of being unable to live alone or requiring assistance from family or medical professionals becomes increasingly likely. Your doctor may not even bring up the possibility of heart rhythm issues because they don't appear unless actively sought. And by the time you feel the effects, the fatigue, the breathlessness, the weakness, it may be too late. There's a reason why many patients are diagnosed with heart failure or stroke only after it's already too far along. This is what is happening. The heart is quietly betraying you. You are at risk. The question remains, what will it take before you see the truth? Time imposes unyielding changes on the body, none more insidious than those that occur within your heart. By the time you reach 60, the mechanisms that regulate your heart's rhythm begin to break down in ways that are not immediately obvious. The heart may look the same on the outside, but internally critical thresholds are crossed. This aging process demands attention, for the consequences of ignoring it are profound and irreversible. As the years accumulate, the heart's electrical system faces an inevitable decline. The cells in the sinoatrial node, the very cells responsible for maintaining a steady heart rhythm, become less responsive. The ion channels that regulate the flow of calcium, potassium, and sodium into these cells begin to malfunction. This is a form of cellular wear and tear, known as senescent decline, which impedes the node's ability to fire electrical impulses in a regular manner. This disruption leads to the development of arrhythmias, conditions where the heart beats irregularly, sometimes too fast, sometimes too slow, but always inefficiently. The risk becomes more immediate as you enter your 70s. At this stage, the heart's ability to adapt to changes in demand, such as physical exertion or stress, diminishes significantly. Blood vessels become less elastic, reducing the efficiency of circulation. The heart becomes less able to compensate for these changes, leaving you vulnerable. Minor exertion, carrying groceries to the car, walking a short distance to the mailbox may result in shortness of breath or an unexplainable sense of fatigue. You may not connect these moments to heart issues, chalking them up to getting older, but this is a false sense of security. Autonomic dysfunction, a process in which the body's automatic systems begin to fail, also becomes more pronounced with age. The vagus nerve, which helps to regulate the heart rate, becomes less effective. The biological mechanisms behind these changes are clear. Vascular calcification, oxidative stress, and a progressive decline in endothelial function all contribute to the breakdown of your cardiovascular system. Yet, the real issue is not these mechanisms themselves, but the consequences they have on your autonomy. As heart rhythm changes become more common, the risk of losing your ability to manage your own life grows. Physician-recommended restrictions on driving, recommendations for constant monitoring, or even the suggestion of assisted living become closer to reality with each unnoticed change. At this stage, medical oversight may become necessary, but the true cost of this oversight is the slow erosion of independence. The doctor may tell you that you must change your lifestyle, but they won't tell you how much it hurts to lose the freedom to make your own choices. The physical breakdown is only part of the story. The real pain is in losing control over what happens to you. You are at risk. And this stage of aging, with its slow and inexorable changes, only accelerates the moment when you must confront the consequences of not recognizing these threats. It is an unsettling truth that as you age, many symptoms are dismissed, not by doctors, but by you and by those around you. Heart rhythm changes are one of the most overlooked. There is a cultural norm ingrained in many seniors that aging naturally brings decline, and with it, the erosion of vitality. This belief allows subtle signs of cardiac distress to slip by unnoticed, with fatal consequences. The very rhythms of your life, your heartbeat, shift in ways you don't recognize as abnormal. What you think is just getting older is actually a silent threat. The symptoms of arrhythmias, such as atrial fibrillation, AFib, often appear with no pain and no clear warning signs. A mild fluttering sensation in the chest, occasional dizziness when standing, or a brief feeling of breathlessness after climbing stairs. All of these are easily attributed to age, to the normal slowing of the body. You might chalk it up to the stress of life, the weather, or even a poor night's sleep. But these signs are not normal. They are red flags of a heart that is struggling to keep up with the demands placed upon it. Biologically, the mechanisms behind AFib are complex. In this condition, the electrical impulses in the heart become chaotic, with the upper chambers, the atria, of the heart quivering rather than contracting efficiently. This disrupts the normal flow of blood, causing it to pool and clot. The lack of symptoms or the misinterpretation of symptoms allows this dangerous condition to fester. You may not realize it, but these clots can travel to your brain, causing a stroke. For many seniors, this is the critical juncture where neglect sets in. When you experience irregular heartbeats, the automatic assumption is that it's simply a product of aging. You might dismiss a minor palpitation or a sudden feeling of lightheadedness because you don't want to admit that something is wrong. You might even accept the advice of family and friends who tell you it's nothing or it's just part of growing old. And here lies the danger. Because the symptoms are so mild, they often aren't enough to push you to seek medical help. But by ignoring them, you're allowing the condition to worsen without intervention. This neglect is not a passive act. It is a pattern ingrained by years of cultural norms that downplay health changes as inevitable. The body grows older, and the heart's rhythms become just one more thing to tolerate. But it is precisely this attitude that causes many seniors to miss the opportunity for early detection and intervention. Instead of monitoring their health, they wait for something to force their hand, not realizing that the subtlety of the changes means their heart is deteriorating, slowly and silently. The consequences of this neglect are profound. By the time a senior experiences the symptoms that force them to seek help, the damage is often irreparable. Medical intervention becomes more difficult, and the chance for full recovery diminishes. You are at risk of losing control of your own health, and as this pattern of neglect continues, you may soon face a reality where the choices made by others, family, doctors, caregivers, will take the place of your own decisions. This isn't simply about heart health. It's about your life, your autonomy, and the control you still have over it. The cost of neglect is more than physical. It is the cost of living without agency. When heart rhythm changes go unnoticed, the impact is not confined to the body. The consequences are far-reaching, affecting far more than just your physical health. The silent degradation of your heart's function carries with it a price that extends beyond blood pressure and pulse rates. It affects your autonomy, your dignity, and ultimately, your very quality of life. The longer you allow these changes to persist without seeking treatment, the steeper the price you'll pay, and it won't just be in medical bills. Atrial fibrillation, along with other arrhythmias, carries risks that extend far beyond an irregular heartbeat. The stagnation of blood in the atria, a hallmark of AFib, can lead to the formation of blood clots. These clots can travel through the circulatory system, eventually reaching the brain and causing a stroke. The toll of a stroke, loss of mobility, speech, and independence, is irreversible. Even without a stroke, the failure of the heart to pump blood effectively can lead to heart failure, a condition in which the heart's ability to meet the body's needs deteriorates to the point where it can no longer maintain basic functions. This is not some abstract risk. This is the reality of living with unchecked heart rhythm issues. The gradual loss of heart function can make even the simplest tasks, walking to the store, climbing stairs, or even standing up from a chair, exhausting and overwhelming. The physical decline accelerates, and with it, a loss of independence. What was once a routine task can turn into a monumental challenge. Before you know it, the physical strain of these daily tasks will require assistance. The real cost, however, is not simply the physical strain. It's the erosion of dignity and independence. The moment your family begins to step in, asking you not to drive, to rely on them for simple errands, or to let them manage your health decisions, is the moment your autonomy begins to slip away. You may not realize it at first, but the absence of immediate symptoms means that your family, your doctor, and even you are complicit in this slow surrender of control. The more time passes, the less power you have over your own life. If you haven't noticed the signs of heart rhythm changes, this doesn't mean they aren't there. It means they're being ignored. Ignored not just by you, but by those around you who fail to recognize the early warning signs. The failure to address these issues has consequences that are far more serious than most realize. Strokes, heart failure, and the increasing need for caregiving are only the beginning. There is also the loss of the ability to care for yourself, to make your own decisions, and to live independently. As these symptoms go unchecked, the emotional toll becomes even more profound. The frustration of knowing that you can no longer do what you once did, the helplessness that accompanies needing someone to assist with the simplest of tasks. This is the true cost of silence. The more time passes without intervention, the more irreversible these consequences become. You are at risk, and this cost, the cost of silence, will ultimately change not just your heart, but your life. The question is, will you act before the damage is done? When seniors visit their doctors for routine checkups, heart rhythm issues are often overlooked. Medical professionals frequently fail to address the subtle changes in heart function that may be occurring, and it is not because they lack knowledge. It is because they rely on a pattern, waiting for overt symptoms to present themselves before taking action. However, this is a dangerous and deeply flawed approach, especially when it comes to heart rhythm disorders like atrial fibrillation. This oversight is rarely discussed, but it happens every day in medical offices across the country. The clinical reality is that many healthcare providers will not actively check for arrhythmias unless they are explicitly prompted. This is despite the fact that arrhythmias, particularly AFib, are common in older adults. The silent nature of these changes, often asymptomatic, means that doctors may not think to investigate until something catastrophic occurs. By the time a patient experiences a major event, such as a stroke or heart failure, the window for early intervention has already closed. The biological mechanisms behind this issue are crucial. The electrical system of the heart continues to degrade over time, but the gradual onset of symptoms often prevents early detection. The biological process is one of cellular degeneration. The electrical conduction system in the heart, particularly the atrial myocardium, becomes less efficient with age. Fibrosis in the heart's electrical pathways increases, slowing conduction velocity and promoting arrhythmic activity. These issues are compounded by age-related changes in the autonomic nervous system. The issue is not that these conditions are hard to detect. It's that they are often ignored until they become urgent. Medical professionals may prioritize more pressing issues, diabetes, blood pressure, cholesterol levels, while the subtle but dangerous irregularities in your heart's rhythm go unnoticed. This can be a fatal mistake. In many cases, patients themselves are unaware of the risks. You may go years without realizing that a mild sensation of fluttering in the chest or lightheadedness upon standing is indicative of something more serious. These mild symptoms are easy to write off as normal aging. However, when the doctor fails to question these changes or address them directly, it only perpetuates this dangerous assumption that nothing needs to be done. The truth is this: routine health checkups are failing you. It's not that doctors are unaware. They simply wait for more obvious symptoms. Unfortunately, by then, the damage is often irreversible. Arrhythmias, such as atrial fibrillation, require early diagnosis to prevent the escalation to conditions like stroke, heart failure, and chronic disability. But by the time you experience overt symptoms such as fatigue, dizziness, or difficulty breathing, it may already be too late for effective intervention. This neglect from both healthcare providers and from you sets the stage for a future where treatment becomes less effective and your independence is lost. The failure to address these issues is what allows the heart's irregularities to remain hidden, slowly deteriorating the body's capacity to function. You are at risk, and the truth is that most routine checkups fail to adequately address the issues that could determine your future. The time for early intervention is slipping away. What your doctor isn't mentioning yet will be critical, but it may not be discussed until it's far too late. By now, you understand the severity of heart rhythm issues and the consequences of ignoring them. The threat is real, and the risk of losing your independence, your dignity, and your life itself is imminent if these issues are left unchecked. The medical system has failed you. Your own awareness has failed you. But there is still one final opportunity to take control before you lose everything. It is not too late, but it will be soon. The first step in protecting yourself is recognizing the importance of regular heart checks. Your physician may not bring it up unless you do, so you must take it upon yourself to advocate for your own health. Don't wait until you feel fatigued, breathless, or dizzy. By then, the damage is already in progress. Instead, demand that your doctor checks your heart rhythm during each visit. A simple electrocardiogram, ECG, or Holter monitor can detect irregularities that would otherwise go unnoticed. The importance of this cannot be overstated. Catching heart rhythm issues early allows you to take action before your heart fails, before you face the debilitating consequences of stroke or heart failure. The early identification of atrial fibrillation, for example, can lead to interventions that drastically reduce your risk of a stroke. Blood thinners, medications that control heart rhythm, or even procedures like cardioversion can restore normal heart function and prevent the worst outcomes. But beyond the clinical measures, there is something even more critical that you must do. Recognize the subtle symptoms. A mild fluttering sensation in your chest, the occasional dizziness upon standing, the breathlessness that accompanies climbing a few steps. These are not signs of simply getting older. They are indications that your heart is struggling and that struggle must be addressed. Ignoring these signs is the same as letting a fire smolder in your home. It may not burn immediately, but eventually it will destroy everything you care about. Taking responsibility for your heart health doesn't mean relying solely on the medical system. It means being proactive. It means learning how to test for irregularities on your own. A simple self-test, like checking your pulse regularly and recording any irregularities, can provide valuable information that you can then share with your healthcare provider. It's not foolproof, but it's an additional layer of protection. You must also be prepared for the reality that your doctor may not always be forthcoming. Not all clinicians will take your concerns seriously, especially if you have no overt symptoms. But don't let that stop you. Be persistent. Demand that they listen to your concerns and that they take action if necessary. The decision to ignore these changes is not just a medical failure, it is a personal one. You must act before you become a burden to others, before the restrictions on your independence become unavoidable.